It is a discussion segment, and we will be talking about rainy season and health challenges. In Nigeria, the rainy season brings much needed relief from the scorching heat, but it also comes with serious health challenges, from mosquito-borne diseases like malaria to waterborne infections such as cholera and typhoid. The wet weather creates favorable conditions for germs and diseases to spread rapidly. As communities struggle with flooding, poor drainage, and contaminated water sources, the risk of sicknesses rises. Understanding this health risk and how to prevent them is key to staying safe during the rainy season. In this report, Trust TV's Adamu Imam tells us what informs the choice of those turning to other treatment alternatives. Now let's take a look.
Heavy rains bring increased moisture and stagnant water, creating ideal breeding grounds for mosquitoes. This has resulted in a rise in malaria and other related illnesses. A close look at treatment options shows that many residents now rely on alternative medicine rather than visiting hospitals. Advocates of such remedies continue to promote their use.
But by the time you go for test and you understand that, okay, your issue is malaria and you are treating that malaria, by the time you finish treating the malaria, the headache will go. But when you go on treating headache without treating the malaria, the headache maybe at that time it will just subside, but it will not go.
A week or two, I've used one of these alternative medicine from KD Healthcare, and I feel so relieved. You understand? So from then I realized, because I've been taking these Western medications, do you understand? It will give me a relief of a day or two. It will now come back. But this one that I've took from this KD Healthcare, do you understand? I feel so much relieved, and for now, like this, I can recommend someone to go for it.
To say, but it's only God. If God can provide for you, you can be able to come. Even somebody did not advise you, if you come here or somebody just tell you something about it, you'll be able to come and see what they are doing there. As I just came now, it's my sister that invited me to come and see what she's doing there, and I was confused really that maybe me too, if I have the means of coming, by the grace of God, I will come and check myself without me going to the hospital.
Alternative medical practitioners also emphasize the importance of exploring these remedies, especially for ailments considered curable.
From malaria will take so many kind of medication, injection, but yet it is not responding. But to our own case, we have what we call Chin Hao. It's a Chinese remedy. It's a organic remedy that cure malaria. And not only curing the malaria, rather it also gives protection as a vaccine for some months. So that is why you see it's one of the major things we sell in the rainy season.
Previous reports suggest that the country's economic situation has pushed more Nigerians to prioritize alternative medicine as a cheaper and accessible option. Adam Imam, Trust TV News, Bauchi.
Well, joining us today to shed more light on this topic is Dr. Abdulmalik Bello. He is a medical doctor and mental health advocate. You're welcome to this program, Dr. Abdulmalik.
It's my pleasure. Good morning.
Good morning.
And, with the issue of rainy season, we do have so many concerning reasons that come up. One of the most important things is to consider is that when we have this rain season, even though we have the positive impact that help the agricultural sector, but it do have its concerning effect, which is the diseases that it causes. And how does it cause all these things? Like most of the things that you consider is the stagnant water that is being, being kept. Because when we have rainy season, we do have floods, we have a stagnant water accumulation. So the stagnant water, this can be even a bottle cap of water. Like you put in, let's say, a water in a bottle cap. This can be a breeding ground for mosquitoes. and this can have millions of mosquitoes inside that
As
stagnant
little as
water.
that.
As little as that. And you can imagine that mosquitoes are very, very, the process of how we get malaria is that when these parasites enter your body, like the way you handle it, it needs something that we call that, aggressive treatment. And that is why you see that most of the time Nigerians, like when they have malaria treatment, you see that when someone goes for malaria treatment, then he sees that after the treatment he still has the malaria. And then another thing is like due to the flood that we have because of the rainy season, it mixes with pure water, which leads to waterborne diseases like cholera, typhoid. And then the weather itself being cold and humid, you see that this is ground for growth for molds. And when you have growth of molds, this of course brings about fungal infections and very high risk problem for people with asthma and with low immune system, like people like the children and elderly people, which is a big problem. But one of the things we have to know is like, how can we prevent all these things? This is the most important thing. First of all, with malaria, like of course using like well-treated nets, and don't think that you can self-medicate. This is one of the main problems we have at the hospitals. Like when patients come, they think that because I know that I'm supposed to take like a normal ACT combination drug like Quatem, then they start taking it. And then they believe that injection is more faster to cure your malaria than the drug, which is wrong. Actually, it's the medication that it's more potent. Why? Because like they give injection because the oral route can be given. Maybe you have been vomiting, you've been having diarrhea, and then you don't have enough fluid in your system. Then they give you injection. But the first line of treatment, of course, is the drug. After taking the drug, then even if you've taken the injection, then you continue with taking the drug. So once you know that you have symptoms of like persistent headache that won't go away with normal painkiller like Panadol, paracetamol, you should head to the hospital. Do not induce self-medication to yourself. And just like typhoid also, like typhoid is very, very similar to malaria. We can say that almost 90% of the symptoms of malaria is the same as the typhoid, but the only difference is how you know you have typhoid is that typhoid comes with stomach pain. And then you see that you have this stomach pain and also persistent headache. And one of the key things is like when you go to the hospital, regardless of your test, you might have a malaria test and it will turn negative, but you still will continue the treatment for malaria. Why? Because like the viral load, the parasite load inside your system might be very less, but it has already started accumulating. And then one of the things that I'd say is like one of the most important things, like everybody like most of the time they already have the parasite in them, because you already live in this endemic zone, so we mostly have the parasite. So once you haven't done full treatment, which means full eradication of the parasites in your system, you always have this parasite, and your body will always want to fight it. But now when your body is trying to fight that malaria in your system, it's your immune system that would actually play a major role in helping you curb this malaria. So now what makes the immune system get low? Like stress. Stress is one of the key things that when you are stressed, automatically your body lower the immune system effect, and you see that you are more prone to simple things like cold and of course the malaria. And that is why they say that stress is like sugar for bacteria.
Oh, really?
Exactly.
This is new to me, honestly.
Well, so in a country like ours, you've said almost everything at this point.
Yeah.
How frequent should we be treating malaria with or without the symptoms?
So basically you can't start a malaria treatment if you haven't recognized you having malaria. So the first thing is like just like I said, it's the complete eradication of the malaria when you have the malaria, so that you will not have reinfection, or a relapse. So once you know that you have malaria, you should go, and then you should, and one of the main things people don't do is completing the dose. Once you start taking the malaria tablets and you feel you're okay, you feel that there's no need. But how doctors treat this malaria is they treat it with the parasite you have in your system. Let's say you have a malaria that is a malaria plus plus. Now, if a doctor is treating that malaria, it will treat it according to the parasite load inside your system, not just taking the drug. Because like all these drugs, when you see them, you can see the ingredients inside the drug. You see like, okay, some drugs are ACT, artemether. We have some drugs that are also piperaquine. So all these are different ways that doctors use to treat them. And after now having, let's say, injection, now you'd see like you'll be given a full drug, like let's say a drug that you will complete the dose. So after that the complete dose, the full parasites will be eradicated from your system. So now remission of that malaria will be in, let's say, like 4 to 6 months, which is healthy for you. But most people feel like, once I feel better, I don't need to take that full treatment, and that's the main issue.
Okay, now let's talk about the healthcare system in its entirety. How can healthcare facilities in Nigeria optimize their preparedness and respond to the increased incidence of rainy season-related illnesses? Because it's no longer news that when the rain comes, almost everybody, 90% of 100 gets sick. So how do they optimize their preparedness?
Yeah, I feel like even the hospital needs to, be wary of, nosocomial infections, like simple as, making the hospital very hygienic for the patients. Because like, even if you go to the hospital and, we have the hygiene of the hospital being altered, of course, it's also a ground for you to have, these infections. So, and also the ever readiness of the doctors and nurses. We live in a healthcare system whereby everybody is nonchalant towards these things. When you go to the hospital, no one cares about how you feel. Nobody, you sit down and you coughing. They don't even separate you from the people that are already infected. And then if someone is healthy and comes to the hospital, then he gets infected with someone else's.
That's the irony, You come to the hospital and take out diseases.
Yeah, you're supposed to be, treated, and then you go to the hospital and you have
another issue.
Another
So, what role does sanitation and personal hygiene, play in reducing rainy season illnesses? I mean, we've seen, like you mentioned earlier, stagnant water, piled up trashes in some areas, drainages that the water is stagnant there also. So how does personal hygiene reduce health challenges during
personal hygiene is like, at the top. It's the apex of, the whole thing. Why? Because like, let's just imagine in your homes, like where you have, now we're in the rainy season, and then we have the humid environment. So now you wearing wet clothes, or maybe leaving clothes that are wet, it's 90% availability of growth of molds. And these molds, like when you inhale these molds, you don't even know them. Like for example, having wet walls, like wet clothes, when you inhale them, these gives your immune system becomes very low, thereby giving you like pharyngitis, like being a problem for people with asthma, and also people with respiratory infections also. So this is very bad. So I would urge people to open your windows, make everywhere dry, take out all these wet clothes, wash your hands, most especially, wash your foods before you eat, because of the waterborne diseases. Always wash your hands, wash your foods, and wash your utensils. Yeah, this is very, very important.
So you just gave an awareness right now. So do you think the healthcare providers, what role do you think they play in educating and creating awareness to people on how to prevent themselves from like getting infections from the rainy season illnesses?
Well, like I do know that when you go to the hospital, like especially when you have persistent influenza. Like persistent influenza is when you have a cold that turns out to be a sore throat, then it turns out to a cough, and then eventually it doesn't go away. Like most doctors give you like leaflets, the hospital, whereby this leaflet shows you like basic things that you do. And I see when when was it, like there was this stuff I saw on Instagram, like people from these social media outlets, they're creating awareness also, which is very good, about food that you need to eat, that improves your immune system, like ginger, like honey, like vitamin C, fruits, oranges. Also, these are things that of course, will help out, in eradicating, these infections, and people will feel much better. Like before you go to the hospital, that yeah, I can make myself, a barricade for these, infections. Yeah.
Yeah. So how can parents protect their children from rainy season related illnesses?
Especially like children, because of their immune
Between
immune system.
5 and
Yeah. So with children, you have to monitor how they actually play around. They shouldn't be exposed, especially knowing that their immune system is very low. Like they need to cover up themselves, like using warm blankets, and ensuring that when they like have wet clothes, you take them out, and like let's say they don't stay dehydrated. This is also very important. Like you need to always make sure your child is hydrated, because being dehydrated also reduces the immune system. And also, like just like I said, making sure if they stay in a room, you should always open the window. Don't close the window, because closing the window will engage in this like mold growth activity, which will give out to infections like sore throat and all of these infections. Yeah.
So there's this misconception about rainy season illnesses. You talked about malaria, which is it's very persistent in rainy seasons. But you talked about mold right now that causes other illnesses. So and an average Nigeria talks about malaria all the time. He gets a headache, it's malaria. He has sore throat, it's malaria. So how do an average Nigerian distinguish between malaria and and you talked about the self-medication too. So how will they go about it?
Yeah. So if you want to let's say distinguish between these symptoms, you realize that how malaria comes. It comes first as your body gives an emergency signal, which is a fever. Like most of the time, people think that fever it's also a disease of itself, but see, fever is like an emergency response mechanism in your body that shows that something is going on. So you start having fever, and most importantly, you realize that you start having fever during the evenings, like during, let's say, around 4, 5, 6, and then you start having these chills and joint pain. This is the first symptom of knowing that you have malaria. And whenever you eat, you feel like you want to throw up, you feel like you want to vomit the food that you've eaten. And then these headache is a constant thing that like just like I mentioned, even with painkillers, it doesn't go away. This is the first symptom to know that yeah, it's malaria, like definitely it's malaria. And of course, like like since we've grown in this environment, like I'm 100% sure like you've gotten malaria more than like 100 times, or so when you just feel the symptoms, that this is malaria. Yeah. But still we do have some sicknesses that are very similar to this malaria, but with the malaria, just like I said, that headache will be constant. Even with medication, it would go away.
Like cold and pneumonia and the rest.
Yeah, just like the cold and pneumonia, like when you take paracetamol for headache, it will go away. But with malaria, it will stay persistent.
So what kind of medications, or how important is it for people to have first aid boxes in their homes? And what kind of medications should be in the first aid boxes before they go to the hospital, or before a doctor comes around?
Well, I'd say like if we would have a first aid, it should be like a basic like treatment plan for you, not like because if I say that okay, you need to have like malaria tablets, you wouldn't be able to say that okay, this is the dosage of how you're supposed to be taking it, which this needs to be guided by a doctor. So I'd say like you have your standard paracetamol here. You need to have your standard like ethanol, like a spirit, which of course this is for, let's say, maybe if you've got a cut or something, and then a bandage, a plaster, and scissors. These are basic things, because going out of the line will go into like a professional field. Yeah.
So Okay, what are the key considerations in the clinical management of patients with these diseases, rainy season related diseases, taking into account local healthcare resources and guidelines? Because that's what most Nigerians go to, local healthcare and what have you.
Like you mean how they treat
Yes, the considerations and the clinical management of the diseases.
So with local health, like we'd say that first the main thing that they go, even if you go to, let's say, a hospital, like in any local healthcare here in Nigeria, like once you have fever, the first thing they do is they take your full blood count. Once they take your full blood count, now they check the parameters over there. And when they check the parameters, they see your, platelet levels. They check, your white blood cells and see, even before. That's why I said, like, even if you've done a malaria test, and that is why, like, in hospitals, what they do is they join the test together, the malaria plus full blood count. It's a combination.
It's a combination.
We have a machine that does the test together. It doesn't separate the test. It does it all at once. It does the malaria and the full blood count together. And then when the result comes out, even when the malaria is negative, as you can see that the malaria parasite affects your plasma cells and the red blood cells, of course. So the red blood cells, when they are broken down, it shows in your full blood count that your blood level is lower. So seeing that the blood level is low and you having fever, the first consideration that they do is, they go into malaria treatment automatically. They give you artesunate injections, fluid management, and that's the first guideline. Like before even thinking about going into something else, this is the automatic response that they do in emergency situations.
So I would like to ask this question: when are we going to start having vaccinations, or should I say vaccines for typhoid? I mean, I've seen it. I don't know how long for cholera, for malaria. How does that play, in preventing some of these health challenges that we?
Yeah, of course, it plays a great role because, like, in so many in countries like Europe and other countries, they're talking about different diseases. They've gone out of these tropical diseases because that's not even their main concern. Because like typhoid, dengue fever, malaria, it's not even of a concern. So I believe like we are closing on to the to that level. But the problem is like the healthcare system here is the levels have mitigated so low that we are not putting much effort in the healthcare system. But if the government can actually like put more effort in establishing a proper healthcare system, seeing what's wrong, what we need, these are things that will become of a thing of a past. We will not even be disturbing ourselves. We'll be venturing into how we can cure cancer and proper diseases, like diseases that are life-threatening. Malaria will just be a thing of a past. But of course, slowly, gradually, we see we've reached a place whereby malaria drugs now aren't something very hard to get. I remember it's everywhere. Like 5-10 years ago, for you to get a malaria drug, you see that only one type. Only one type. Either you get like Fansida or chloroquine. Now look
but
at
now
it.
you have different.
And
it has effects. Some people have this
reactions.
Some people have reactions to chloroquine, so they can't take it, so they have to go and take Fansida.
Okay, so quickly, are there any specific, Fatima, it's related to one of Fatima's questions, but with a twist, are there any specific or vulnerable populations like children, elderly, and immunocompromised patients that are at a higher risk during the rainy season in Nigeria? And also, does it have to do with blood types or genotypes or what have you?
Oh yeah, there's this misconception that the genotype of people that have blood group O and AA also there. So basically if you'd say how do mosquitoes even find you, let's say in a room where in the clothes,
exactly, how do they detect you are AA?
You know why I ask these questions? I'm AAA plus and I get malaria every 2 weeks. So
I am AA too.
Does it have to do with blood groups?
You'd say first of all, if you want to understand this, I'll try to break it as easy as I can. So basically now mosquitoes, they need blood, the fresh plasma inside your blood. They need it because the female mosquitoes, the Anopheles mosquito, she's pregnant. She needs.
No, please,
you know,
let me
It's my
use
blood
us to
she
be
needs.
pregnant. They are using
Oh,
our
wow.
blood to be
she
pregnant.
needs that, plasma inside
you have
your
to be
blood.
very-
Okay. So now, what she does, like, if we are in, let's say, like a dark room now, how they detect people is by, the bacteria in your sweat. That's how it has like a sensor, or your carbon dioxide. So if you are breathing, breathe it out, that carbon dioxide that comes out,
From
that's,
your
that
breath.
signals, like,
Signals the
yeah, there's
mosquitoes.
a human there.
Oh, wow.
Yeah, so
I
definitely.
mean, he was smiling when he was saying that, because I saw a video of a guy saying, if mosquitoes need our blood to so it means we are fathering all the mosquitoes.
Fatima, I know
that
you're a
are
very
newborn.
generous person. Be generous today to give mosquito your blood.
No, I'm not going to do that. So, curiosity, right?
Okay.
Out of curiosity, I mean, I've seen how Nigerians back then took the initiative to eradicate, sicknesses, or should I say diseases like chicken pox as of that time, measles, and what have you. So, if that initiative is given, even during COVID, I mean, we saw how vaccines were brought in and people were forced to, take the vaccinations and what have you. Do you think similar initiative could actually eradicate malaria once and for all out of Nigeria?
Yeah, it's possible. It's possible. Definitely possible. One of the major key zones, like the endemic zones we have here in Nigeria, it's like, forget about, like, the urban areas. Like, where we have real problem that we need to tackle is like the rural areas. Malaria is life-threatening, and we get to see how life-threatening malaria is when you go to rural areas. Because believe you or not, when you go to rural areas, they can't afford your 6,000 naira medication malaria. So what they do is they take herbs, like normal herbs, or just herbs that actually help them feel relief from the fever, not the malaria. So in turn, what it does is, like, that malaria eventually travels from the liver to the brain, and even having people have psychosis. That's the end stage of malaria. So
Psychosis.
Exactly. So if we can have, like, healthcare system, I don't know, like AMVAC, like, let's say ambulance, whereby, like, it's a steady ambulance where it will be placed in these rural areas that would lead directly to the hospital, and reduce, have a type of, let's say, palliative that would have a subsidy with these malaria drugs. Like, they will really help in these rural areas, give them free medications for malaria, because so many people, these people that are already living in a place where the waterborne disease is, like, something like a family to them, because of the water, the intake of water they was already, like, contaminated. So now having stagnant water, you can't even imagine, so malaria, it's almost there, like, 24/7. So once that these rural areas can be tackled, believe me not, like, we've already solved 80% of the malaria issue here in Nigeria.
Wow.
Wow.
Thank you so
Thank
much.
you very much,
No
Doctor.
problem.
Dr. Abdulmalik Bello, for taking your time to come share your expertise on this aspect that we just talked about.
Thank you so much. Thank you very much for shedding more light.
Thank you.
It's a very profound insight
And
right there.
indeed, it is.